Hi, I'm Dr. Schott at the Spinal and Sports Care Clinic, and this particular video would to discuss the rationale behind doing spinal decompression therapy. As I mentioned in a prior video, one of the number one reasons that we do spinal decompression is for disc herniations, when the inside of the disc has actually leaked out and is compressing on one of the two nerve roots that exit in the lower spine. So how does it work? How does that accomplish? Basically, because things are compressed in the lower back, then what we want to do is decompress or do a intermittent form of traction on the lower back. So this is the table that accomplishes that, and we're able to have the person lay down in a very comfortable fashion, either on their stomach or on their back. We strap them in, and we'll demonstrate this at another time. We'll have a person that we set up on to show you how it works. But basically, a person lays down in a very comfortable manner. We engage the table via a computer mechanism, which is, it tells us precisely how much weight we want to use for the amount of traction, the amount of time we want to pull at the rate at which it pulls. Plus, we can make some adjustments on the table of how high the table should be, how low the table should be, and so we can really dial this into a person's specific needs to give them the best outcome. And the whole thing is revolved around this mechanism, and we engage it. The table now separates. So when the straps are connected, then the traction will basically do this kind, but very, very slowly, at this, not this rapid, but this form of intermittent traction, which means it pulls at a certain rate for a period of time, and then it reduces its amount of pull for another period of time. So it kind of milks the disc back and forth, back and forth, back and forth. And this is where the spinal decompression varies from standardized traction. When you do standardized traction, it's just one constant pull that doesn't vary over the amount of time that you're performing it. And we think there's an advantage to spinal decompression because it varies the amount of pull, and we think that's a very healthy physiological benefit to help get the disc kind of sucked back away from the nerve and bring that back towards the center of the disc. This table also is capable of doing traction or spinal decompression in the neck or the cervical spine as well. In this particular case, you would flip the person around on the other end. There's a mechanism that we install within this base here, and a person lays down, and then they're kind of laying at an angle this way. So again, very, very comfortable position, and it provides the same kind of benefit for pulling on the neck as it would for the lower back, because we can certainly get herniated cervical disc as well as disc problems in the lower back. Now, in addition to disc herniations, we can also use this table for other reasons. Just very stubborn back pain that come from different types of other problems. For example, facet syndrome. So facet syndrome are the joints in the spine that connect. There's not the disc in the front, but the small joints in the back, which you might actually get a chiropractic adjustment to do manipulation, and it makes that popping sound. That's where the facet joints are located. But sometimes those facet joints get very, very irritated, inflamed, and we have a setting on the table where we can do a pull pattern that is designed to relieve the pressure around facet joints, not just discs. So it's a very versatile table, and we can use it for that condition. You may have heard of a condition called spinal stenosis. Spinal stenosis is a condition where when you look at the top end of the spine, you have an opening where that spinal cord runs through there pretty freely, but due to degenerative changes, bone spurs, disc herniations, etc., that channel becomes more clogged, like a pipe that gets clogged with calcium and other junk that builds up over time. So now the nerves and the blood vessels passing through can't get through without being impeded. And we might be able to use this table to, again, provide that intermittent traction to open up and give that area a little bit more space. If you've ever noticed, anybody that has spinal stenosis, you generally kind of gravitate toward this position. This is a position of relief for a lot of people for stenosis. This is not a good position to be in. So we have the ability to adjust the table to put people in a slight flexed position while we're doing that spinal decompression. So it's a very, very useful table for a variety of different conditions. And now at a later video, we'll actually demonstrate the setup of people being both in the cervical traction decompression position as well as the low back spinal decompression position.